Good afternoon. Good afternoon, ma'am. Good afternoon, everyone present over here. So, ma'am, first, I will be very grateful to you because Garbhasanskar was in my wish list for a very long time. I'm truly happy that I have completed this course from your academy. And I'm thankful to Seema for her wonderful coordination with me for this presentation. So, let me get into this topic of childbirth. Prasava, it is a term which refers to childbirth, delivery, and labor. So it is the process of delivery of the fetus forcefully matured inside the mother's womb. And there are three criteria for labor. First one is spontaneous onset of labor. That is the physiological onset of labor. We have to get the pain naturally without any medication. According to modern science, the pain will happen because of maternal and fetal hormones. But according to Ayurveda, there will be 5 factors responsible for the onset of the labor. They are time, nature, past life deeds, detachment of the umbilical cord, and the maturation of the fetus inside the womb. Second criteria is cephalic presentation, that is, the baby's head should be present downside of the uterus. And the third criteria is the labor should progress continuously without delay and without any complications. There are 3 types of labor. First type is normal labor, second one is preterm, and third one is postterm. When the delivery is happening between 36 to 40 weeks of gestation through vagina, it is called normal labor. And if the delivery is happening before 36 weeks of gestation, it is called preterm labor. And it is happening after 40 weeks of gestation, it is called postterm labor. And the duration of labor will be varied between primigravida and multigravida. Primigravida is a person who is laboring for the first time. So the duration will be 12 to 15 hours of time for the first time delivering woman. And the multigravida is a person who will be delivering the baby for second or third time. So the duration will be up to 7 to 10 hours of time. The woman who is delivering for, in the second time, the duration of the labor will be half when compared to her earlier pregnancy. So the signs of labor, the true signs of labor includes progressive contractions. Because of the continuous contractions, the woman will get pain continuously. There will be release of mucus plug, which is the brownish discharge, and there will be a gush of amniotic fluid, and the dilation of the cervix will happen. The 4 P's which are very important during labor are power. The pregnant woman should have the power to tackle the pain because of the contractions, and the passage represents the cervix and the vagina through which the baby will get delivered. Passenger represents the baby who is inside the mother's womb, and paying attention. The woman should be quite alert to her body signals, and she can do breathing techniques like Lama's breathing to get better oxygenation at the time of labor. So next one will be the stages of labor. There are 4 stages of labor. First stage is the dilation of the cervix. First, the cervix will get effaced. That is, thinning and softening of the cervix will happen. And then the cervix will get dilated from 0 to 10 centimeter. Second stage is crowning stage. Once the cervix got dilated fully, the birthing of the baby will happen. Third stage is the birthing of the placenta. Once the baby get delivered, placenta and the umbilical cord should come out within 20 to 30 minutes after the birth of the baby. And the fourth stage is the involution of the uterus. Involution of the uterus represents the uterus is getting back to its original size after delivery. And there are 3 types of delivery. First one is forceps, second one is vacuum, and third one is water birth. In my case, no, I got induced. I didn't get a natural pain. At the last moment, I couldn't push my baby efficiently. My baby's heart rate get reduced. So my doctor suggested to do forceps delivery. So mine was a forceps delivery. The fetal presentation, cephalic presentation helps for vaginal delivery. If the baby is in breech position or in transverse lie, we couldn't deliver the baby vaginally. Episiotomy will be there at the time of vaginal delivery. It is an incision between the anus and the vagina, that is in the perineum region. There will be two types of episiotomy, midline episiotomy and mediolateral episiotomy. The last slide is about the actor score. It is to check how well the baby is doing outside the womb and how well the baby has tackled during the birthing process. It will be taken during the first minute and at the 5th minute after delivery. If the score is 7 and above, the baby is doing well. If the score is 5 and below, the baby has to take care. Thank you, ma'am. The rest of the slides will be taken care by Seema.
Gayatri, you will scroll for me, or should I do?
Yeah, I will scroll for it.
Okay. Good afternoon, everyone, and my guru, Dr.Nutan ma'am, thanks to you to give us wonderful knowledge for Garbhasanskar. My topic is yoga for healthy childbirth. First, जो जर्नी हमारे स्टार्ट होती है चाइल्ड बर्थ के लिए, सबसे पहले स्टार्ट होती है प्री कंसेप्शन पीरियड से, जब हम लोग जाते हैं गर्भ संस्कार के लिए, तो वहीं से they will guide us for both of partner how can we plan for healthy baby. So they will start with Shat Kriya. They will because if healthy ovum and healthy sperm come with the body, then we can produce the healthy child. So they will suggest you for your Shuddhi Kriya for both partners for healthy sperm and healthy ovum, and balance your all Pitta, Vata and Kapha. So they will suggest you some Shuddhi Kriya like Neti, Dhoti, Basti before conception period. After that, they will suggest you some diet and some pranayama, some meditation, and some basic yoga asanas like Sukshmayama, lots of different type of Sukshmayama. So our journey start with like this. When we after conception, when the mother is pregnant, we have other module. We have 3S module, so Dr.Nutan ma'am taught us about in Garbhasanskara. So we have to help in the pregnancy semester, trimester wise, like first trimester, second trimester, and third trimester. The first trimester come with stability, second trimester for strength, and third trimester come with the space creating, because it helps for normal delivery, vaginal delivery. So in first trimester, because the fetus is very small, tiny fetus, so it help us for stability, maintain in the womb. For mother also need to be stable mentally, physically, emotionally, and spiritually, and fetus also. So we have to come with the basic asana, like very basics for stability, like starting with Sukshmayama, and for breathing exercises and other like Sukhasan. You can simply sit in the Sukhasan and start your whatever you're chanting and mantra, like Vajrasan, Parvatasan, and Padma Asan. So you have to be normal for stability. You can do these asana. Now next you have to be Virasana, Setubandh Asana. Setubandh Asana is very good for stability. Any trimester you can perform Setubandh Asana if you don't have any other problems and anything. Now Savasana for relaxation and for release your stress, anxiety. You can perform Savasana anytime. And pranayama, it's good for your improve the lung capacity. And it help for it's good for lung capacity and help for the third trimester for when we have to be delivered. So now and Ustrasana, it's a very good pose. जो camel pose है, Ustrasana is very good for our lungs and our thighs muscle and give upper body strength. Natarajana asana is for balancing asana and Vrksasana, because in second semester we need strength in our back and our lower body part. We have to we have to prepare our body for third trimester, for normal pregnancy, normal delivery time. We have to be prepare our body for that. Next, for third stage, for come with space. We need space because we have to planning for normal delivery, vaginal delivery. So it really helps for that only. Just like Ardha Konasana, this is good for pelvic region. It's give the space in our pelvic region, lots of space. It create our lower body part. Setubandh Supta Konasana, Malasana is very good for our create the space in our pelvic region. And this is Vishnu Asana, Gomukh Asana, and Virbhadra Asana. All these asana is very good for a healthy pregnancy and healthy child, and it's helps for the normal delivery. And in third trimester we have to be, if we do mantra chanting and Lamaze breathing, it helps us to for bear the pain in the pregnancy time. So it's, if we follow the all third trimester taught by Dr.Nutan ma'am, we learn from in Garbhasanskar. She's give us the wonderful knowledge for everything. So it's improve our sleep, our reduce stress and anxiety, increase the strength, flexibility, endurance, and muscular muscles needed for the childbirth time, and it decrease of lower back pain, nausea, and headaches, and shortness of the breath. And if we go for prenatal yoga classes, we have to create a good bonding with other females, other pregnant ladies, other pregnant ladies, like emotional, and we have to reduce our stress also, to being a new parent. Like, thank you so much, and thanks once again my guru Dr.Nutan ma'am and my co-partner Gayatri, and thank you all of you to listen me carefully. Thank you so much.